President Joe Biden has tested positive for COVID-19, interrupting a significant campaign event intended to boost support among Latino voters during a crucial phase of his re-election campaign. Biden, 81, is experiencing mild symptoms and has begun treatment with the antiviral drug Paxlovid, according to his physician. "I feel good," Biden, who is fully vaccinated and has received booster shots, assured reporters in Las Vegas, giving a thumbs up before boarding Air Force One to travel to his Delaware residence. He will self-isolate there in accordance with CDC guidelines. Biden and his aides have emphasized his recent campaign appearances as a testament to his energy and suitability as the presumptive Democratic nominee, aiming to quell rising concerns within the party. The Las Vegas event, scheduled as part of the Unidosis annual conference, was designed to demonstrate his direct engagement with a diverse electorate. However, the event was abruptly halted when it was announced that Biden had tested positive for COVID-19 after participating in an interview and meeting voters at a local supermarket. "I just spoke with President Biden. He is deeply disappointed he cannot join us this afternoon," Unidosis President and CEO Janet Murguia announced to attendees after Biden's delayed appearance. It remains unclear where and when Biden contracted COVID-19, but his diagnosis will keep him out of the public eye at a time when Democratic lawmakers are eager for his presence. The CDC recommends isolating until the person has been fever-free without medication and their symptoms have been improving for 24 hours, followed by 5 days of mask wearing. A White House official stated that Biden, who has had COVID-19 before, will continue to stay engaged through video calls. The Biden campaign plans to adjust and conduct as many activities remotely as possible. Biden spent the previous weekend at his Rehoboth Beach, Delaware residence, making calls to key lawmakers, some of whom still harbor concerns about his candidacy. Although calls for Biden to step aside had paused after the attempted assassination of former President Donald Trump, they have resurfaced with Biden's return to the campaign trail. Hours before Biden's COVID-19 diagnosis was announced, California Representative Adam Schiff, a Senate candidate and former House Intelligence Chairman, publicly urged Biden to withdraw from the race. As Trump is expected to accept the GOP nomination at the Republican National Convention in Milwaukee, Democrats are anxious that Biden might not be able to defeat him, risking the prospects of other Democratic candidates in down-ballot races. Despite growing unease following Biden's debate performance in Atlanta, Democratic officials indicate that the White House and Biden campaign are more receptive to feedback. Conversations with lawmakers are ongoing, with Biden showing more willingness to listen than his public stance suggests. Vice President Kamala Harris will proceed with her scheduled campaign event in Fayetteville, North Carolina, despite Biden's diagnosis. Harris's husband, Doug Emhoff, tested positive for COVID-19 earlier this month, though Harris herself tested negative. Biden, who was seen without a mask before boarding Air Force One, wore one in the car and on the flight to Delaware. His doctor reported that Biden had upper respiratory symptoms, including a runny nose and non-productive cough. Despite feeling okay initially, a positive COVID-19 test was confirmed after his condition did not improve. Biden first tested positive for COVID-19 in July 2022 and experienced a rebound case shortly after. He has received multiple booster shots, with the latest in September 2023. During his first encounter with the virus, he had mild symptoms and was treated with Paxlovid. Nationwide, COVID-19 cases have risen in recent weeks. The CDC reported a 23.5% increase in emergency visits for COVID-19 and high viral activity in wastewater as of July 6th. Thanks for listening. Please like, subscribe, and comment for more fresh news.